Hello, I am Dr. Jayasree, Senior Obstetrician and Gynecologist at Ankura Hospitals, Banjara Hills. Today we will be talking about how a woman should prepare for a healthy pregnancy. Most of the times we see women coming to us already conceived. 2 months or 3 months after they start their pregnancy, they come to us. Instead of that, what these days is ideal is able to plan the pregnancies beforehand. When a lady can plan her pregnancy, there are so many things which should be done before they plan their pregnancy. When a woman starts her pregnancy with optimal health, in a very good health, the outcome, throughout pregnancy the problems will be less, the baby will be born healthy. So, mother and baby to be healthy, it should start much before the pregnancy starts. So, there are few things we should be able to identify before they become pregnant, which can be corrected, and the lady should achieve optimal health before pregnancy. So, there are few conditions which we should know before they plan pregnancy. See, we see so many women with problems like diabetes, thyroid, all these diseases also are possible during pregnancy. So, there are few investigations which we can do before planning pregnancy. So, we have to check whether anemia is a very common condition, that is low hemoglobin is very common. Anemia is very common in Indian women. 70 to 80% of the Indian women are anemic. That means most common anemia is iron deficiency anemia in our country. So, we have to check hemoglobin levels, that is complete blood picture of the women. And also there are conditions like hemoglobinopathies. You must have heard about conditions like thalassemia. So, these are the conditions which we can diagnose before. So, we check the hemoglobin, type of the hemoglobin the woman is carrying. There are abnormal hemoglobins which are responsible for this thalassemia and all. So, testing for thalassemia before pregnancy is also very important. Like that, there is a virus called Rubella virus. Rubella virus, if it attacks during a pregnancy, it can destroy the developing fetus or cause multiple defects in the developing fetus. So, we should also check about the rubella status of a individual. So, usually the rubella vaccination is given when a child is around 9 months old. Sometimes it can miss, or some girls even after receiving the vaccination may not develop immunity to the rubella virus. So, we all can check the status of rubella, whether lady is immune to rubella or not. If they are not having immunity to the rubella, we can give vaccination before planning pregnancy. Likewise, chickenpox also. If they develop chickenpox during pregnancy, it also causes problems to the mother and baby. So, usually chickenpox, if it occurs in the childhood, it gives lifelong immunity. So, if you should always ask about the history of having chickenpox in childhood or not. If they had chickenpox in the childhood, they are likely to develop chickenpox in later ages very less. If they are not immune to the chickenpox, or if they have not developed chickenpox in childhood, even this vaccine can be given before planning pregnancy. And also there are multiple vitamin deficiencies, like vitamin D is very important these days for fertility and also during pregnancy. And many of our Indian women and men, everybody is, in spite of being in a country where there is sunshine throughout the year, we are deficient of vitamin D. So, the vitamin D, if it is not in the range of what is actually required, is around 30 and above units. So, if it is deficient, we should also correct vitamin D deficiency. Likewise, B12, folic acid. Folic acid is very important. Folic acid supplementation should be started at least 2-3 months before planning pregnancy, because if there is deficiency of folic acid, the baby in the early weeks of pregnancy sometimes can develop some central nervous system related neural tube defects. So, these defects of the nervous system can be prevented by giving supplementation of folic acid prior to planning of pregnancy. At least 3 months we can give this folic acid supplementation. It is also very important. Likewise, if person is deficient or malnourished, poor nutritional condition, all those people who are underweight, that means they are undernourished, their health is not optimal, or likewise overweight, and these days we are hearing about so much about polycystic ovarian disease. So, girls with PCOD or many are obese. So, overweight, underweight, all these conditions can be corrected before planning a pregnancy. Likewise, age also, age at which you conceive is also very important. Nowadays, we see in rural areas mainly pregnancies in the teenage pregnancies, marriages much before the teenage marriages and teenage pregnancies are really very harmful to the teenage pregnancy, causes so many problems. Those girls who become pregnant in young age can develop severe hypertension during pregnancy, and their system, the reproductive system is also not well developed. So, they are prone for complications during pregnancy. They may be anemic, they may be ending in premature labor. So, pregnancy related complications are more in the younger age group if they conceive in younger age around 16, before 16 or above 35. Likewise, pregnancy in very late age above 35 is also causes many problems. You know, as you are aging, you are likely to develop medical problems during pregnancy. So, 35 and above is called elderly primary. They can develop hypertension, diabetes, pregnancy related complications, because of diabetes, oversized babies, difficulty in labor, more of cesarean deliveries, all happens because of advanced maternal age. So, either sides like younger age group and elderly age population also get into problems. So, all these, you know, because these days we see pregnancies at a later age because of education or career, many women are postponing pregnancies. The ideal age to conceive is about 20 to 30. If they conceive, the complications will be less. If you cross 30s and if below 20, the complications are more. So, women should also plan their pregnancies around this age where they can be healthy, the baby will be healthy. And as I said, some more investigations, whatever, like some of the infections which the women are prone, they may be having infections which like HBsAg. This is hepatitis B virus. If it is HBsAg. This is an infection which can be transmitted to the child. Likewise, HIV, AIDS. We should also know about their status about HBsAg, HIV. All these tests can be done before. If there is any positive patients which they need special treatment before getting pregnant. So, there are so many factors which we can correct if we plan the pregnancy properly. So, all women should also plan their pregnancies, and many of times even now we get women after conceiving coming for termination. They say we didn't plan this pregnancy, we are not settled financially, so still I am doing job, I am still a student, doctor please help us, we don't want this child. So, these are the things which can be, which should be prevented, See, advice from a gynecologist before marriage regarding contraception. This is how to avoid pregnancy. Birth control measures are very important, then they are safer than opting for a miscarriage after you conceive. So, it is very important. That is why the pregnancy should be planned. You should not come with unplanned, unwanted pregnancy and ask for a miscarriage. We definitely try to help them if they are in a situation where they cannot be helped. But these are all conditions which can be prevented with proper planning.